Hello, thank you for joining us today at our exciting panel discussion on the topic of who are social entrepreneurs. We're delighted to be hosting Dr. Hammond from the Ashoka network. Many of you will have heard of the fantastic work that Ashoka are doing across the developing world, working with new pioneering entrepreneurs. We're also delighted to be highlighting the work that Al is involved in with his new company venture called e-healthpoint, providing rural healthcare in India. So we hope you enjoy today, and thank you for joining us.
We basically provide a one-stop shop: clean water, real doctors, diagnostics, and real pills at prices people can afford. The alternative, if you really want a real doctor, is you take a bus to town. It costs you typically about $10 for the lost wage, the bus trip, and the doctor's fee. So we have a very high value proposition, just on economic terms and on quality terms. So we're seeing that people love this model. It gives them opportunities they simply haven't had for a high quality urban type service in their local village. And they are lining up in significant numbers.
Jim, you travelled extensively in other places in the developing world. What was it that hit you specifically on this trip?
One thing that really jumped out at me that I didn't know before going there is that 70% of that 1.2 billion live in isolated, poor, rural villages and have no access to those benefits of globalization. So there's a really uneven playing field in that regard. Healthcare falls into that category of things that you would expect would be available at the village level. The alternatives are terrible, and they're solving that problem. But if government's not going to do it, and big companies can't do it, it's up to social entrepreneurs to come up with creative ways to do it. This investment that Eleos is leading in e-healthpoint, it's a loan and a below market rate of interest, but it's convertible into equity. So if the company really takes off the way that they think it's going to, there's a chance at really significant returns. If not, then it's more of getting your philanthropic oriented dollars back with a modest return.